Let's look at fibrocystic breast disease. You can find this on figure 17.9. Fibrocystic breast disease is characterized by the presence of multiple palpable nodules in the breast. These nodules usually are associated with pain and tenderness and fluctuate with the menstrual cycle. Over time, these cysts can enlarge, and the connective tissue of the breast is replaced with a dense, firm, fibrous tissue. Now, although the risk of breast cancer is not increased with fibrocystic breast disease, the diagnosis of cancerous breast masses become more complicated because the breasts they continuously feel lumpy because of these lumpy cysts. Cervical cancer, almost all cervical cancer or carcinomas are caused by HPV. They're diagnosed by Pap tests, and age and risk factors determine how frequent the Pap test should be performed. The patient should be informed of factors that can interfere with a Pap test result, including menstruation and the use of vaginal creams, spermicidal foams, and douching 2 to 3 days before the examination. The medical assistant should include in the patient's history the use of certain medications, such as tetracycline, which may interfere with the results, whether the patient has a latex allergy, the date of the last menstrual period, LMP, whether the patient has a history of bleeding disorder or is taking anticoagulant medication, and whether the patient is pregnant or may be pregnant. Looking at cervical dysplasia or carcinoma continued, we're looking at 1710, and this is a visual. The stages of carcinoma start at 0 and go to stage 4. So figure 1711 shows the colposcopic appearance of a normal cervix in A, so that's here, and an abnormal cervix, which is B. Colposcopy is a visual examination of the vagina and cervical surfaces through the use of a colposcope. It can be used during a vaginal examination to locate and evaluate abnormal cells, to detect cancer of the cervix in early stages, to examine tissue from which an abnormal Pap test has been obtained, and to monitor areas of the cervix where malignant lesions have been removed. LEAP, and you'll have an assignment with LEAP this week. What does LEAP stand for? It's the Loop Electrosurgical Excision Procedure. In figure 1712, we see the colposcope view of the cervix, and LEAP procedure in B, we see LEAP biopsy of abnormal cells here. Okay. Endometrial and ovarian cancers. Endometrial cancer begins with hyperplasia of the endometrial wall, followed by dysplasia. The treatment involves a complete hysterectomy with radiation therapy and chemotherapy. Ovarian cancer is second most common gynecologic cancer, but is ranked first in gynecologic cancer deaths. Symptoms do not appear until tumor has enlarged enough to exert pressure on nearby structures. So usually it's found when patient is complaining of pressure or pain. Researchers are currently working to perfect a blood test that can be used to screen for ovarian cancer, so the disease can be diagnosed in earlier, more treatable stages. Little is known about how or why ovarian cancer occurs, but pregnancy, breastfeeding, and oral contraceptive use may reduce the risk. Breast cancer is the second leading cause of cancer deaths in women. Indications of breast cancer include palpable breast mass that is firm and immovable, breast pain, tissue thickening, nipple retraction or dimpling, nipple discharge. And it's also important to note that there's a breast cancer called inflammatory breast cancer, and indications of this is typically a rash on the breast that does not go away, and it's diagnosed and treated differently. If a breast mass is palpated, a mammogram or ultrasound of the area is ordered and indicated. Also, if they see that, a biopsy is performed. Procedure 17.3 describes how to teach the patient to perform breast self-examination, and this procedure is very important to make sure that your patient understands and to really encourage them to do their self-examinations because they are the first line of defense in finding breast cancer. So breast cancer treatment almost always begins with surgery, so a mastectomy or a lumpectomy. Radiation therapy is used as follow-up to destroy any remaining cancerous cells, and sometimes axillary lymph nodes must be removed if cancer has spread. Now we're going to go into the second part, 17.2, pregnancy complications, menopause, and assisting in female examinations. Here, we continue our objectives by distinguishing among diagnostic tests that may be done to evaluate the female reproductive system, summarize patient education guidelines for obstetric patients, in addition to legal and ethical implications in a gynecology practice. So let's talk about the anatomy and physiology of pregnancy. Zygotes form when fertilization occurs. It implants into the uterine wall within 5 to 6 days while cells continue to multiply. The placenta forms within the uterine wall and the fetus is encased in the amniotic sac filled with fluid. The next stage of development is the embryonic period, which includes the 3rd to 12th weeks of pregnancy. This is the first trimester. Why do you think this period is such a crucial time for the developing fetus? It's because this is when all of the tissue and organs are developed. So here, there are 3 trimesters. The first trimester is 1 to 14 weeks. The second trimester is 15 to 28 weeks. The third trimester is weeks 29 until the delivery. Paturation includes labor and delivery. It's essential that the pregnant woman understand the importance of nutritious diet and of avoiding potential harm during the first trimester. During the second trimester, the uterus has enlarged to above the umbilicus and the patient feels the first fetal movement. It's called quickening. It's a very exciting time. The third trimester is marked by rapid fetal growth with the baby gaining close to 1 pound per week. Here we see the stages of labor, and you can find this figure in your book. It's figure 1715 to look at the stages more closely. Potential causes of infertility. So history of sexually transmitted diseases or infections, failure to ovulate or irregular ovulation, congenital abnormalities of the reproductive organs, endometriosis, medications that reduce fertility, and advanced aging. Some couples are unable to have a child because of the inability of sperm and the ovum to unite. And there are things that they can do and go to a fertilization clinic and find out the reasons and work on why they're not uniting and what's happening. Have you ever heard of an ectopic pregnancy? An ectopic pregnancy is one that occurs outside of the uterus. And although an ectopic pregnancy can develop on or near the ovary or the abdominal cavity, they mostly occur in the fallopian tubes. Rupture of the fallopian tubes containing an ectopic pregnancy is a serious event that requires immediate surgical intervention to prevent fatal hemorrhage. So, abortion, miscarriage, and miscarriage is under that title as well. Spontaneous, so abortions do not have an identifiable cause. Complete, so complete expulsion of both the fetus and placenta with no medical intervention. Incomplete expulsion of only parts of the fetus and placenta occurs. So this would happen if you had a miscarriage, but you might have to have some expulsion of the rest because your body did not expel it itself. Missed, the fetus dies in utero and must be removed surgically. And threatened, cervical bleeding occurs, but dilation does not, and pregnancy continues uninterrupted. It's estimated that 1 in 3 pregnancies terminates by a naturally occurring abortion, and in most cases, the causes are not clear. Placental abnormality or placenta previa. In placenta previa, the placenta implants in the lower uterine segment. If the previa persists throughout the pregnancy and the placenta is implanted on or near the cervix, when the mother goes into labor, dilation and effacement of the cervix can cause the placenta to tear loose. Maternal disorders, here it's talking about gestational diabetes, GDM, is any degree of impaired glucose tolerance during pregnancy. Responsibilities include performing blood tests as ordered, completing a routine urinary dipstick test at each visit, and providing a referral to a dietitian for help with diet therapy management. Although gestational diabetes goes away after birth, the woman has a higher risk of developing diabetes mellitus type 2 later in life. Studies indicate that the best medical treatment for gestational diabetes can be insulin therapy. Continuing on maternal disorders, gestational hypertension. This is pregnancy-induced hypertension, can be mild to severe and occurs in approximately 10 to 15% of pregnancies. Hypertension accompanied by the proteinuria, which is protein in the urine, after 20 weeks of pregnancy or preeclampsia or toxemia can all be other side effects or can be accompanied by, and they're important to watch. Responsibilities include monitoring the pregnant woman's vital signs, reporting sudden weight gain, and performing routine urine dipstick tests. If preeclampsia persists, the patient is at risk of severe headaches, vision disturbances, and convulsions either before and during labor. An emergency cesarean section may be required to prevent serious maternal complications. So it's important to make sure that documentation is complete and accurate for the findings to help alert the physician of possible problems with the hypertension. Menopause is the permanent ending of the menstruation as a result of cessation of ovarian function, usually occurring between 45 and 55 years of age. There's perimenopause, which begins when hormone-related changes start to appear, and it lasts until the final menses. Symptoms may include hot flashes, concentration problems, mood swings, irritability, migraines, vaginal dryness, urinary incontinence, dry skin, and